on the Health Watch, millions of Americans might be taking aspirin daily without their doctor's advice, and that is a problem. Dr. Mallika Marshall is here tonight.
And Dr. Aspirin can cause some serious problems.
It can. It can cause serious bleeding, and so it's not routinely recommended for people over 70 or people who have peptic ulcer disease or ulcers in their stomach that might cause GI bleeding. So researchers at BI Deaconess and at Harvard Medical School found that 6 million Americans over the age of 40 without known heart disease are taking aspirin daily without a doctor's advice. They also found that nearly half of people over 70 without known heart disease are taking a daily aspirin, and many people with peptic ulcer disease who again are at high risk of bleeding are taking it. So they're encouraging doctors and other healthcare professionals to talk to their patients about the appropriate use of aspirin so that they don't get in trouble.
Is this still the sort of thing though where if you are at risk, you're an older American, you probably should have an aspirin on you at some point in case you have a heart attack?
If you've had a history of heart attacks, but again, that's something to talk to your doctor about. Otherwise, healthy 70-year-olds do not need to walk around with aspirin.
Okay. All right. And how often do you think I should really take a mental health day? Oregon is becoming one of the first states to allow students to do just that.
And what do you think about this, doctor?
You know, I think it's interesting. I mean, it was last month that Oregon's governor signed this bill into law that allows students to take mental health days just like they would a sick day. And Oregon, unfortunately, has some of the highest suicide rates in the country. And it was actually the students who organized and lobbied to try to get expanded mental health services. Now, critics of the law say, it probably wasn't necessary. Why don't we just have kids continue to lie or sort of make up illnesses if they need to stay home? But supporters are hoping by making it part of the law that it will reduce the stigma of mental health illness, and that people, kids in particular, will talk to teachers and parents about these issues if they're feeling anxious or depressed. Just, you know, Utah passed a similar law last year.
You were saying, Paula, when you were a kid, sometimes you'd say to mom, hey, you know, I can't do it today.
I remember my mother saying, well, yeah, you know, kids get very tired. How many stories do we do about children who are really exhausted? And I actually think by identifying it, people might pick up on a pattern if a child is talking about a mental health day more than they should.
Exactly, instead of just saying my belly hurts, which a lot of kids make up.
Very interesting. Doctor, thank you so much, as always.
You're welcome.